WCN Pre-Congress interview series. My name is Fernanda Arce, and I am the ISN Social Media Manager. Today, we are honored to have with us Dr. Brett Cullis. Brett Cullis is a consultant nephrologist and intensive care specialist in South Africa. He has developed peritoneal dialysis programs in South Africa and is involved in expanding services in many African countries. He is the chair of the ISN Saving Young Lives Steering Committee and sits on the ISN Interventional Nephrology Working Group. Dr. Cullis has trained doctors from more than 15 countries in bedside insertion of TENCOF catheters. His special interest is in critical care nephrology and nephrology service provision in developing countries. He was a primary author of the ISPD guidelines for PD in AKI. I would like to also welcome Dr. Sabine Karam, WCN social media team member and part of the 2021 ISN Emerging Leaders cohort. Welcome to you both.
Hello and good afternoon, Dr. Cullis. How are you today? Thank you for accepting to get this interview with us. I'm calling you from Beirut, Lebanon, and I'm speaking with someone who's located in South Africa. So that's very exciting to link together the global nephrology community. Today I'm interviewing you for the purpose of the World Congress of Nephrology, where you will be giving two very exciting sessions. To start, I would like you to tell us a bit about yourself and how you became interested in the field of nephrology and critical care.
Thanks, Sabine. So I trained as a nephrologist and then subspecialized in intensive care medicine. So I've got a big interest in critical care nephrology. But then I returned back to South Africa after my training in the UK and have spent a lot of time helping develop programs here. And I'm currently chair of the Saving Young Lives program, which is very much focused on developing acute kidney injury programs in low middle income countries and how to treat people with acute PD. So it's very much a field I'm interested in and very passionate about.
So you spent some time in the UK and then you went back to South Africa. Can you tell us what really made you wonder about differences in terms of nephrology care between the UK and South Africa?
Yeah, so in the UK and in high-income countries, it's a very different disease, acute kidney injury. In low middle-income countries and low-income countries, patients are often young, they are fit and healthy, and if you can get them through their acute kidney injury, then they tend to go back to a good quality of life. They often become economically active again. So in the South African setting and in Africa, it's a field where you can make a huge difference. High-income countries, tends to be a condition of patients with multiple comorbidities, tend to be older patients. You can also do a lot to help them, but it is very different to the low-income countries.
Tell us a bit about peritoneal dialysis and what places does it have in the nephrology care in Africa and South Africa in particular?
Yeah, so PD is ideally suited to most of our low-income countries. It's easy to do, it's cheap, it can be done in rural areas. You don't need electricity, you don't need water, and it's much easier to train the nurses how to do acute PD. Whereas hemodialysis is expensive, you need a lot of infrastructure and a lot of training. So acute PD is ideally suited, and outcomes have been shown to be as good, and with recovery of renal function may even be slightly better.
So you'll be giving two talks where I think you will be talking about PD in the World Congress of Nephrology. The first talk will be PD for AKI during COVID, and the second will be talking about the ISN 0/25 interventional trial. Can you tell us a bit about both of those talks?
The acute PD in COVID, that is very much about acute PD in Africa. COVID has been a difficult condition to treat in Africa. In many places, you can't actually treat patients with AKI who have COVID. Most units won't actually treat them. So there's not been a lot of acute PD for COVID. However, I do look into why acute PD is ideal in these settings and what we've achieved through saving young lives. My second talk is on the ISN interventional trial for 0x25, but I look at the whole 0x25 program right from the beginning through to where we are now, and how it's taught us so many things about treating AKI, how we can move forward with developing programs, what lessons we've learned, and how we can make a difference.
I know that the Save Young Lives project now spans 3 continents.
Yeah, so Saving Young Lives, as you say, we have expanded. So over the past 2 years, we've gone into Southeast Asia and South Asia. And this year we are training in Latin America. So we have expanded throughout the world. As far as the 0x25 study, the interventional trial, I was responsible for the African sites. But there are sites in Nepal, Brazil, and Colombia. So we, again, are spread out around the world.
So going back to Saving Young Lives, because our auditors might not know a lot about it, can you tell us a few words about this wonderful initiative?
Yeah, so the Saving Young Lives program, it's a partnership between the ISN, ISPD, IPNA, and EuroPD. And we help to develop acute kidney injury programs around the world in low and middle income countries, basically training people how to do acute PD for AKI. But it's not only about that. If you're training about acute PD, you've got to train people how to deal with acute kidney injury and how to try and prevent them going on to PD. So it's a fantastic initiative. I've got a superb steering committee, and they have done huge amounts of work around the world setting up these programs. We've trained over 360 doctors and nurses how to put in PD catheters, and we've treated over 500 children with a greater than 60% survival. So it does seem to be working.
So it seems that you've been advocating and working to implement PD in Africa and other places through several initiatives, through the COVID-19 crisis, through the Saving Young Lives program, and through the 0x25 initiative. What do you think about the progress of all those endeavors?
So I think the initiatives have been helpful. So the 0x25 initiative, I think, has got us to a point where we know how to approach the various healthcare providers in the different countries, how to set up these programs. We've learned a number of lessons of what not to do and what to do. It's now time for us to actually implement those in a real world setting. And the 0x25 initiative, so the Saving Lives initiative, we again have learned a lot, but it's going from strength to strength, and we are training exponentially in terms of the numbers of doctors and nurses that we're training. So it's very exciting times.
So what's the percentage of patients on PD, you think, in South Africa right now as compared to hemo? Okay,
so as far as chronic patients is concerned, we've got around 14% of patients on PD. That's predominantly in the government sector. And we've moved over the last 5 years to very much a PD first policy in South Africa in the state sector. And that's because of the understanding that it does free up resources. We've had no expansion in hemodialysis resources. So PD is growing in the state sector. The private sector, it is very static, and that is seen around the world. And there's a number of reasons why it's not growing in the private sector.
Absolutely. So my last question is, what continues to inspire you as you move in this journey and this passion that you have developed to improve outcomes of acute kidney injury?
I think the thing that inspires me the most is the champions that we train. It's all about the people that actually go out there and do the hard work in those environments. And there's so many people that are enthusiastic. They give their time. They keep to develop programs. They're the ones that keep me going. And then obviously the patients. It's so nice to see reports coming back of where we've trained people, and suddenly you hear about, you know, the patients that survived that would never have got treatment in the past.
Of course, thank you so much for inspiring us every day and through this talk. And we are very much looking forward to attend both your talks at the World Congress of Nephrology. Thank you very much.